In the aftermath of the Mueller report's conclusion, national politics is pivoting toward health care, a perennial favorite issue for Vermont legislators. Joyce Hottenstein, a small business owner from Rutland, and Peter Briggs, a dairy farmer from Addison, join us to discuss new legislation that threatens to make the costs of health coverage even more punishing. Peter, you are a member of MediShare?
Correct.
Why did you join a healthcare sharing ministry?
Well, the farm originally had a group healthcare plan, and eventually everybody aged out of it and went on Medicare, and I was the only one left. That was through MVP, and the deductible was about $10,000, and it cost over $400 a month for me.
Wow.
So my employer started looking around, and MediShare advertised that they save the average family about $600 a month, which I'd say is quite correct, even nationally, because they are saving me over $300 a month. I'm paying just under $100, or my employer is, for my MediShare.
So when you switched to MediShare, you started saving $300 a month?
Correct.
Wow.
Some of that's getting put toward savings so that I'll have money to cover the deductible and other things like a decent suit.
That's nice. And so you are a farmer, and this is a different option. Instead of going for MVP or Blue Cross Blue Shield, this is one option for it.
Right, and it works really well. For one thing, I live a fairly healthy lifestyle. I am health conscious, so it works really well for me because MVP Blue Cross was not giving the kind of lower rates to those who are young and healthy like MediShare does.
And Joyce, you are a small business owner. Are you able to provide health insurance to your employees?
I used to be able to provide health insurance to my employees. As a matter of fact, because I am a healthcare provider, I always felt that that was my duty to provide health care for my employees. Right. Unfortunately, when the exchanges took over, we lost our plans through the society that we were purchasing them from. They got rid of all of the Chamber of Commerce health plans that were also options that I could have partaken in, and forced us into the exchanges. The options that were available were significantly more expensive. Out of pocket was ridiculous, and the fact that my business couldn't use the premiums pre-tax and we had to pay taxes on that expanded on those expenses. So I chose to, for the most part, give my employees a stipend to help pay for their own health care.
So it seems like Vermont legislators either champion or crush reforms for political reasons, let's say to defy the Trump administration or to prop up the state's insurance exchange. Or do you see a certain prejudice here against religious groups like the healthcare sharing ministries or the self-reliance of entrepreneurs? You talked about chamber plans, association health plans. What would you say to that?
Well, I would say that probably the biggest reason why they don't like MediShare is because it's not under their control. It's not one of their monopolies either. MediShare is a smaller organization. It's not the big granddaddy like Blue Cross Blue Shield that's lobbying the legislature for a closed market.
So it is political?
I'd say it's very political.
Okay. Okay.
I would tend to agree with that. I don't. The prospect of losing health share ministries as an option, I think, is driven solely by the fact they need more people in the exchange in order to keep it affordable for everyone.
So they basically want other people to take a hit so that they don't have to take it themselves. Peter, Joyce, don't go anywhere. We continue our conversation next week at the Equinox in Manchester. Join us then.